What is hormone receptor status in male breast cancer? Imagine a tiny lock and key system inside your body where hormones act as keys to unlock certain behaviors in cells. In male breast cancer, understanding whether these keys fit the locks on cancer cells is essential. This is what we call hormone receptor status. It tells us if the cancer cells have specific receptors that respond to hormones like estrogen and progesterone. These receptors are like tiny antennas on the surface of cancer cells that detect hormones circulating in the body. Most male breast cancers are hormone receptor positive, especially for estrogen receptors. This means the cancer cells have these receptors that can bind to estrogen, which can promote cancer growth. Many of these cancers also have progesterone receptors, which respond to progesterone. When cancer cells have these receptors, they tend to grow in response to hormonal signals, similar to how some normal breast cells behave. Knowing the hormone receptor status is very important because it influences treatment options. If the cancer is hormone receptor positive, doctors can use hormone therapy to block or lower hormone levels. This can slow down or even shrink the cancer. Treatments like hormone-blocking medications are often effective in these cases. The presence of hormone receptors also gives clues about prognosis. Generally, hormone receptor-positive cancers tend to grow more slowly and have a better short-term outlook. However, they can sometimes come back many years after initial treatment, so ongoing monitoring is important. To find out the hormone receptor status, doctors perform a biopsy, which involves taking a small sample of the tumor. They then use a test called immunohistochemistry to measure the levels of estrogen and progesterone receptors in the cancer cells. The results help determine the best treatment plan. Understanding whether a male breast cancer is hormone receptor positive or negative helps doctors personalize treatment. It guides decisions about hormone therapy, surgery, radiation, or chemotherapy, depending on how advanced the cancer is. In summary, hormone receptor status is a key factor in diagnosing and managing male breast cancer. It helps predict how the cancer might behave and what treatments are most likely to be effective. Always remember, each person's situation is unique, so it's essential to discuss these details with a healthcare professional who can provide guidance tailored to individual needs.